Most men over 60 assume that if a private habit has never caused obvious pain or discomfort, it must be harmless. After all, you've probably followed the same routine for decades without giving it a second thought. But here's what many men don't realize. As your body ages, the same habits that once had little effect can gradually begin influencing your circulation, sensitivity, prostate health, and even your confidence without any clear warning signs. In today's video, I'll walk you through 10 masturbation mistakes that older men should avoid. The first 3 are rarely discussed, yet they may have a greater impact on your long-term health than most people realize. After that, we'll cover 7 additional mistakes that I frequently explain to patients during consultations. One of them surprises almost every man who hears it. Before we begin, please take a moment to subscribe and turn on notifications if you enjoy practical men's health advice. And in the comments below, tell me where you're watching from. I always enjoy seeing our community of viewers from around the world and learning how far these conversations are reaching. The first mistake isn't something most men even realize they're doing. It happens automatically, especially during moments of excitement. Many older men unconsciously hold their breath while masturbating, believing it helps them reach climax more quickly. In reality, it often does the opposite over time. Biologically, your body depends on a steady supply of oxygen to keep your heart, brain, muscles, and blood vessels working efficiently. When you repeatedly hold your breath, oxygen levels temporarily drop while your muscles tense and your blood vessels narrow. Instead of encouraging healthy circulation, you're creating unnecessary strain on the very system responsible for strong blood flow. After 60, when circulation naturally becomes less efficient, this habit can become even more significant. Emotionally, many men describe feeling exhausted or unusually drained afterward. Rather than feeling relaxed and refreshed, they notice tension, mental fatigue, or a lack of satisfaction. They often assume it's simply because they're getting older, when in reality, part of the problem may be the physical stress they're placing on their body. The solution is surprisingly simple. Slow your breathing and stay aware of it throughout the experience. Take deep, controlled breaths from your diaphragm instead of shallow breaths from your chest. Allow your breathing to remain smooth and natural rather than forcing it. Many men discover that when they breathe calmly, they feel more relaxed, experience better body awareness, and enjoy a much more satisfying experience without placing unnecessary stress on their circulation or nervous system. The second mistake is one that many men never associate with their overall health. It's masturbating when your body is physically exhausted. This often happens late at night after a long, stressful day when your body is asking for rest, but you push through out of habit instead of genuine desire. Biologically, your body has limited energy reserves. When you're extremely tired, your stress hormone cortisol is often elevated, while testosterone and other recovery hormones are naturally lower. Blood flow is also less efficient because your body is prioritizing repair and recovery rather than performance. If you repeatedly ignore these signals, you may begin associating intimacy with fatigue instead of vitality. Over time, this can reduce satisfaction and make recovery feel slower. Emotionally, many men tell me they finish feeling more worn out than relaxed. Instead of experiencing a sense of calm or renewal, they notice they're mentally drained and ready to fall asleep immediately. They often mistake this for aging, when in many cases it's simply poor timing. The practical solution is to pay attention to why you're masturbating. If you're doing it because you genuinely feel aroused and your body feels rested, that's very different from doing it because you're bored, lonely, or exhausted after an overwhelming day. On those nights, prioritize quality sleep instead. Your hormones, circulation, and nervous system perform much of their repair while you sleep. When you wake up well rested, your body is far more likely to respond naturally, and the experience often feels healthier, more satisfying, and much less physically demanding. The third mistake is one that far too many older men overlook because they assume it isn't necessary. It's masturbating without adequate lubrication. While this may not have seemed like a problem decades ago, your body changes with age. The skin becomes thinner, less elastic, and more vulnerable to irritation. What once felt comfortable can gradually create unnecessary friction that your body no longer tolerates as well. Biologically, repeated friction places stress on the delicate skin, nerves, and small blood vessels of the penis. Tiny injuries may develop over time, leading to soreness, reduced sensitivity, and longer recovery periods. When the tissue becomes irritated repeatedly, your body responds with inflammation instead of healthy circulation. That's the opposite of what you want if your goal is maintaining comfort and long-term sexual health. Emotionally, many men become frustrated because they notice pleasure gradually decreasing. They often assume their age is responsible, when in reality their technique may be contributing to the problem. As sensitivity declines, the natural temptation is to use more force, which only creates even more irritation and discomfort. The practical solution is simple. Use a high-quality, body-safe lubricant whenever needed. Lubrication reduces unnecessary friction, protects the skin, and allows movements to remain gentle and comfortable. Take your time and let your body respond naturally instead of forcing the experience. Over months and years, this simple habit can help preserve sensitivity, improve comfort, and reduce avoidable strain on the tissues that support healthy sexual function. The fourth mistake is one I've discussed with many older men over the years, and it's depending on pornography as the primary source of stimulation. At first, it may seem harmless, but over time, especially after 60, it can change the way your brain responds to pleasure. Biologically, your brain relies on a chemical called dopamine to regulate motivation, reward, and sexual desire. As we age, the brain becomes less adaptable, meaning it takes longer to recover from repeated intense stimulation. Constant exposure to highly stimulating adult content can overwhelm this reward system. Gradually, your brain becomes less responsive, making real-life touch and intimacy feel less exciting than they once did. Emotionally, many men begin wondering why they no longer feel the same level of desire or satisfaction. They often assume aging is entirely to blame. In reality, the brain may simply have become accustomed to artificial levels of stimulation, making natural intimacy seem less rewarding. The practical solution is to give your brain an opportunity to reset. Consider taking a break from visual stimulation for a couple of weeks and focus instead on being present with your own thoughts, breathing, and physical sensations. Allow your mind to reconnect with natural arousal rather than constant novelty. Many men discover that after stepping away from highly stimulating content, sensitivity gradually improves, desire feels more genuine, and intimacy becomes more emotionally satisfying as well as physically rewarding. The fifth mistake has nothing to do with desire or frequency. It's masturbating while sitting on the toilet, a habit many older men develop simply because it feels private and convenient. Unfortunately, convenience isn't always what's best for your body. Biologically, sitting on a toilet for an extended period places extra pressure on your pelvic region. Many men also lean forward or hunch their backs, which may further compress the muscles, nerves, and blood vessels around the pelvis. As we age, healthy circulation becomes increasingly important for supporting normal bladder function, prostate health, and erectile function. Spending unnecessary time in a position that limits comfortable blood flow may place additional strain on tissues that are already becoming more sensitive with age. Emotionally, the effects are often subtle. Some men begin noticing pelvic discomfort, occasional groin tension, or changes in urinary habits without connecting them to this long-standing routine. Because these changes develop gradually, they often assume they're simply part of getting older. The practical solution is to choose a position that allows your body to remain relaxed. Standing, reclining, or lying comfortably places less pressure on the pelvic area and allows the surrounding muscles to remain more at ease. Give your body enough room to move naturally instead of staying compressed in one position. Small adjustments like this may seem insignificant, but over time they can contribute to greater comfort, healthier circulation, and better overall pelvic health. The sixth mistake is one I see far more often than most men realize. It's treating masturbation like something to finish as quickly as possible. After years of busy schedules and private routines, many men develop the habit of rushing through the experience without giving their body time to respond naturally. Biologically, rushing keeps your nervous system in a heightened state of tension. Your breathing becomes shallow, your muscles tighten, and stress hormones rise. Instead of activating the parasympathetic nervous system, the part responsible for relaxation, healthy blood flow, and natural arousal, your body remains in fight or flight mode. When that happens, blood vessels don't relax as efficiently, circulation becomes less effective, and the overall experience may feel less satisfying. Emotionally, many men tell me they feel strangely empty afterward. They reach climax, but they don't experience the sense of calm, connection, or satisfaction they remember from earlier years. Over time, the brain begins associating pleasure with speed rather than genuine enjoyment, making intimacy feel increasingly mechanical. The practical solution is to slow everything down. Give yourself permission to breathe deeply, relax your muscles, and remain fully present. Instead of focusing only on reaching the finish, pay attention to how your body feels throughout the experience. As men grow older, the nervous system often responds much better to calm, steady stimulation than hurried intensity. By slowing your pace, you encourage healthier circulation, greater sensitivity, and a deeper feeling of physical and emotional renewal. The seventh mistake is one that almost no one talks about, yet it plays a major role in male health after 60. It's ignoring your pelvic floor muscles. These muscles sit beneath your bladder, support your prostate, and help control both urination and erectile function. Unfortunately, many men don't even know they exist until they begin experiencing problems. Biologically, the pelvic floor acts like a foundation. Strong, healthy muscles help support blood flow, improve erection quality, and contribute to better bladder control. As we age, years of sitting, inactivity, and poor muscle awareness can weaken this area. If those muscles lose strength, erections may feel less firm, urinary dribbling may become more noticeable, and overall pelvic stability can gradually decline. I remember one gentleman named Robert, 70 years old, who exercised regularly and believed he was doing everything right, yet he couldn't understand why his confidence was fading. After evaluating him, we discovered his pelvic floor muscles had become significantly weaker. With simple daily exercises, he gradually noticed stronger control, better circulation, and improved confidence over the following months. The practical solution is to begin strengthening these muscles with gentle pelvic floor exercises. During arousal, lightly contract the same muscles you would use to stop the flow of urine, hold for a few seconds, then relax completely. Repeat several times without straining. Over time, this simple habit can improve muscle tone, support healthier circulation, and help restore the strength and control that many men believe they've permanently lost. The eighth mistake is one that creates confusion for many older men. It's getting the frequency wrong. Some men believe more is always better, while others avoid masturbation for months because they think complete abstinence protects their health. In reality, neither extreme is ideal. Biologically, your body performs best when there is balance. If masturbation becomes too frequent, your body may not have enough time to recover fully, leaving you feeling physically tired and mentally drained. On the other hand, going for very long periods without any sexual activity may contribute to reduced circulation and less regular stimulation of the tissues that depend on healthy blood flow. As men grow older, consistency often serves the body better than extremes. Emotionally, finding a comfortable rhythm helps remove unnecessary guilt and anxiety. Instead of following rigid rules, learn to pay attention to how your body responds. For many healthy older men, moderation usually feels far more satisfying than either excess or complete avoidance. The ninth mistake is using excessive pressure. As sensitivity gradually changes with age, many men instinctively grip harder or move more aggressively, hoping to create stronger sensations. Unfortunately, this often has the opposite effect. Too much pressure may irritate delicate tissues, reduce natural sensitivity over time, and encourage unhealthy friction. Gentle movements, proper lubrication, and patience allow your body to respond naturally without placing unnecessary stress on the nerves, skin, and blood vessels that support long-term sexual health. The 10th and final mistake isn't physical at all. It's masturbating without any emotional awareness or intention. Over the years, I've spoken with many older men who told me that what once felt natural had slowly become nothing more than a routine. There was no excitement, no appreciation for their body, just a habit repeated out of boredom, loneliness, or simply because it had always been part of their day. Biologically, your brain responds differently when intimacy is connected to relaxation, positive emotions, and mindfulness. During those moments, your body releases hormones such as oxytocin, which promotes calmness, emotional well-being, and a sense of connection. When the experience becomes rushed, mechanical, or emotionally disconnected, those natural responses become less pronounced. While the physical act may still occur, many men are left feeling emotionally flat instead of genuinely satisfied. The practical solution is to shift your mindset. Instead of treating masturbation as something to finish quickly, see it as an opportunity to reconnect with your body. Slow your breathing, stay present, and focus on comfort rather than speed or performance. As we finish today's discussion, remember these 10 common mistakes: holding your breath, masturbating while exhausted, skipping lubrication, relying on pornography, using the toilet as your regular position, rushing the experience, ignoring your pelvic floor, getting the frequency wrong, using excessive force, and disconnecting emotionally from the experience. If you found this video helpful, please subscribe, turn on notifications, and share your thoughts in the comments below. Small changes in private habits can make a meaningful difference in your comfort, confidence, and overall well-being as you grow older.